Confirm that the patient is unresponsive, not breathing, and pulseless. Perform hand hygiene and don gloves if time permits. Call for an AED and use it as soon as it is available. If an AED is immediately available, start the AED before chest compressions. If the AED is not immediately available, start chest compressions while waiting for the AED to arrive, and then interrupt chest compressions to use the AED. Open the AED and press the on button to turn on the power. Proceed with the next steps as instructed by the AED. Ensure that chest is bare and dry. Attach the device and place the AED pads in the correct positions. Place the first AED pad on the upper right sternal border directly below the clavicle. Place the second AED pad lateral to the left nipple with the top of the pad a few inches below the axilla. Ensure that the cables are connected to the AED. Inspect the AED pad's adhesion to the patient's chest wall. If the pads are not in good contact with the skin, remove the pads and apply a new set. Allow the AED to analyze the heart rhythm. Press an analysis button if prompted. Wait for the AED to analyze the rhythm. Before pressing the shock button, announce loudly to stand clear of the patient and perform a visual check to ensure that no one is in contact with the patient. Immediately begin chest compression after the shock and continue for 2 minutes. After 2 minutes of CPR, listen for the AED prompt not to touch the patient. If prompted to shock again, repeat steps to allow the AED to analyze the rhythm. Announce loudly to stand clear of the patient and perform a visual check to ensure that no one is in contact with the patient before pressing the shock button. Continue 2-minute cycles of CPR and listen for AED prompts until the patient regains a pulse, the ACLS team arrives, or the practitioner determines death. If the patient regains a pulse, obtain vital signs and assess level of consciousness. Transfer the patient to the critical care unit per organization practice. Ensure that the AED is cleaned and the electrodes and pads are replaced.